you talk a little bit more, Christy, like on your end about that patient kind of checkout process? So everything gets sent to them. Is it primarily through the portal, or are you having to communicate independently with them?
Oh, it's all through the portal. So what we do is the patient care coordinator actually sets up the clinicians' encounters. They write in them. We actually make a subnote with the assessment, and that's what we send to the patient right away. And then and they'll get an email saying that they have something waiting in their encounter history. So then they can go look and see the notes from the clinician right away. And then we actually charge, we don't take insurance. So we do, charge them for their appointment within 24 hours after their appointment. They just have their card on file. They're all aware that that's what we do. And so we just charge that. And then if there's anything else that needs to have an estimate, then we create the estimate, supplements, sales tax, that kind of stuff on the estimate and any other kits. And then we send them another message and say, your estimate can be found here. We give them a link directly to where they can find it. They still have to log into their portal, to find it, but we tell them exactly where to find it. And so then, they can take as much time as they want looking at that estimate. And they just know that they're supposed to respond back to us and let us know what they want. And they can, add extra supplements if they need some refills on things. They can add other test kits that we can ask the clinician if it's okay, that they do those tests now. And so there's sometimes some back and forth, with a patient care coordinator and the patient, but it's pretty, smooth process once they figure out, where to actually find the estimate. So we will call them and, actually, and one thing I wanted to mention, after the first and second appointment for all clinicians, we actually pick up the phone. The patient care coordinator for that clinician picks up the phone and calls the patient within 48 hours of the appointment. So that, because, at any type of patient portal, not just our patient portal, can be confusing at the beginning. They don't know where to look for the clinician's notes. They don't know where to look for the estimate. They don't know, we give insurance invoices, so we'll walk them through that. Et cetera. So we'll call after both of those appointments and kind of walk them through where to find everything. So hopefully by the time they have their first follow-up, they're very aware of, what the process is. But we also send a prep message a week before each appointment, telling the patient exactly what to expect, after the appointment. So, and what they need to do to prepare for the appointment.
Yeah.
And we also keep, sorry to interrupt, Christy, but we also keep, little sticky notes or we have a need to know box on the face page of the dashboard of the EMR. And if we're finding someone is just having a lot of trouble tracking, where things are or how to use the EMR, we sort of flag them as, needing a little more high touch, experience. And we do go the extra mile to try to walk them through. And it could be cognitive impairment. It could be just not comfortable with computers. It could be some of our older patients who aren't sort of born and raised in computer software land, but whatever it is, we try to triage those and make sure that that we're helping those people with a little extra.
And adjust our process. That's a good point, because there are a couple patients that do have trouble, printing out their lab slips, to be able to go to LabCorp or whatever. And so our staff don't generally need to have printers or anything like that, because we're not, we're all paperless. So I have the printer. And so, if a patient really can't figure out how to print their lab slip or, print their encounter notes because they want to keep them in their folder, then I will print those out for them and just, mail them to them so that they have a hard copy of it. And, so we do, like we said, we do a hybrid. We tend to do most everything virtually, but we know that there are times that we have to take, and we want to take the extra, steps to make those patients feel comfortable.